My name's Bridianne and I work at the Black Dog Institute at UNSW, and my background has always been in technology. I did my honours examining the efficacy of online therapy versus face-to-face therapy, and my PhD specifically looked at the impact of Facebook on adolescent development and wellbeing, and then now I've moved into more public health and population-based use of social media for basically monitoring mental health issues in the community and also trying to evaluate what our social media activity says about our mental health. So I'm sure most of you are very much aware of the Black Dog Institute, but one of the things that I think is really important when you're doing ethics applications for your research is that the context of your institute is very clearly understood by the ethics committee, because certain institutes do certain things quite differently, and I know with mine it's very helpful if they understand the context of the institute's work. And this is the Black Dog Institute's lovely vision, and we have a very unique structure at the Black Dog because we have 3 tiers. We have the community team, we have the clinical services, and we have the education, as well as we have the researchers underlying all of that. And so what happens is, because we're quite translational, is that often the research that we're doing also falls into the clinical space and also falls into the community education space. So we have to be really aware of all of that when we are conducting our research and putting in our ethics applications. So in terms of the current context and how do we use social media at the Institute, and then how many researchers are using social media for their projects, I'll go through how we use it at the Institute, but in general there are about 10 projects a month that are using social media for some purpose. So that's quite a lot, and it's quite a lot from an institute level for the director and the executive to be across all of that activity, because it's actually really important in terms of brand management for someone like the Black Dog Institute to be really aware of what is going on social media and how that's affecting our image in the community and the public. Because one of the beautiful things about working at Black Dog Institute is that people automatically identify that as a really trustworthy and reputable organisation. And because that is now online through social media, we really as researchers are not only protecting the integrity of our research, but also the integrity and the reputation of UNSW and the Black Dog Institute. So formally from the Institute level, we have these 5 social media outlets, and you can see we have 95,000 people following us on our Facebook page. So if one thing happens to kind of go wrong on our Facebook page, it has a big impact. Even alone with our Twitter, we've got 23,000. And the Goodnight Insomnia study, this is a particular case study because this is the first time we started having an individual Facebook page for a study. And it was kind of a bit of an experiment. And we only had 2,000 people enrolled in the study. But for some reason or another, it got 22,000 people liking it. And one of the interesting things is about when you're thinking about using social media for your research project, having a page, you really have to have an entry and an exit strategy. Because otherwise that study's finished now, and what are you going to do with those 22,000 people who are following you? So there's 3 main ways that we use social media at the Institute for research purposes. And the first way is that we use it as data. So we really treat social media posts as like the human subject. And these are the projects that I'm primarily involved with. So the 4 studies is, I don't know if any of you are aware of these, but one is called the We Feel project, and this basically measures the emotional sentiment of Twitter data in real time and then spits it out into a graphical representation so that you can compare the emotional sentiment of different continents and different states. And what we used that tool for was we looked at, for example, Australia's response to the budget announcements in 2014, 2015, and we were able to measure the sentiment in the community. We were able to measure emotional responses to the death of Robin Williams, and we could see from our data that the UK was actually the saddest country when that happened, And then that can be used by governments and organisations to implement suicide prevention. And the other thing that we like to do is we correlated all of the Twitter data with World Health Organization real-time measures. And we actually found significantly high correlations that were showing actually that countries that had more rage in their tweets had lower suicide rates, and countries that had higher rates of cheerfulness in their tweets also had higher suicide. And so we're looking at those sorts of patterns and how you can use the emotional sentiment. The Ground Truth Project, and anybody can access the We Feel project. It's publicly available, and it's online. So you can all export the data as well. So that's an issue as well. The Ground Truth Project is where we actually ask for consent to the users, and we follow people who blog about their mental health, and we measure their mental health every 2 weeks, and we export all of their blogging data and correlate their linguistic behaviour with their blogging. And what we found is that for certain individuals, when their mental health deteriorates, their blogging behaviour has very significant patterns in it. So therefore we can track when people's mental health is deteriorating based on just simply their blogging. The other project which I lead is looking at detecting suicide posts and suicidal behaviour on Twitter, and what do suicidal posts look like, and what is best practice for intervention. And this is the project that probably has the highest ethical risk and responsibility, and so I'm going to talk a bit in detail about that because we don't get informed consent from the Twitter users. And then the last one, which we have at the moment, we have a mobile app which you can measure social connectivity, and our aim with the app is to see if we can track when people are becoming more socially withdrawn based on their interactions with other people, their GPS data and their Bluetooth data on their phone. But this app also has the ability to drag all of your social media data from it. And as a researcher, that's a gold mine for me, but most people wouldn't be quite happy with an app that already tells you who you're talking to, how often you're talking to them, and then it can scrape all this data. So we're sort of in the process of conducting consultation around how acceptable is it to people to use all of this data if the data is for good purposes. So the main ethical issues we have around the Twitter data, and in particular the suicide, is the issue around informed consent, duty of care, how do you manage suicide risk and harm. You have geocoded data. So I have the exact longitude and latitude details of every tweet, so I can really identify where those people are. So how do you ensure that their data is going to be stored correctly and remain confidential? And it's interesting because I personally have never had a bad experience with my ethics committee about these issues. If anything, I've actually found the whole process extremely helpful and really important, because I found that there was no possible way that you could even think of all the ethical repercussions that this type of research would have unless you took it to a greater group of people. And so I think the process was actually extremely helpful, and because of that and their responses, I feel like we have a very good project that's very safe and very sound. And I don't think if it wasn't for the ethics committee conscientious nature, I don't think we would have gotten to that point, and I don't think I would be as comfortable sharing this data and using this sort of research as an example. So this is how we kind of dealt with these issues, is that the idea in general is that social media data is publicly available, and that because it's in the public, anybody can use it. And that's kind of true. Except if you actually go and read the terms of service, in particular, these are the terms of service for Twitter, it doesn't actually look like, as a researcher belonging to a university, I'm allowed to just go in and use the data. And you can see there's some quotes, and it says things like, you can view it and you can get access to it through third-party services and websites, but is a university really a third-party website or a third-party service? And then if you have a look here, it says, yes, you can transfer the data in other countries, but only if it's done by Twitter. And then the last one, it's like, yes, they can have additional uses provided the organisations partner with Twitter. So really, if you're being honest, nowhere really in the terms of service does it look like anything clear that I have a right to go in there and study people in this way without their consent. But one of the things, coincidentally, is to get a lot of Twitter data, you typically have to go through something called, well, it used to be called GNIP. And GNIP is owned by Twitter, and therefore, if you're using your data collected by GNIP, then you're really satisfying those ethical requirements. However, given universities are very great and amazing places and full of computer scientists, and GNIP costs thousands of dollars, you can get computer scientists to write the code and collect it for you. So therefore, you really have to convince the ethics committee that you have to be clear that that's what you're doing. You're not using a Twitter organisation or a Facebook organisation, and really you have to be really upfront about that, and they really then make the decision about how risky that is. So in this particular instance, we were working with CSIRO, and we had a grant from GNIP, and we had no problem collecting data. But then as we moved on in, we had our own computer scientists, and therefore the ethics change, and you have to make sure that is very clearly communicated to the ethics committee. And that's just sort of what the terms of service look like. And every single social media site has one, and they're very different. So sometimes I think grouping social media as the one thing together makes it very complicated ethically, because they're actually very different sites. And the mindset of people when they're using these sites is also very different. And that's why Twitter, it's a lot easier to assess, is because the general community mindset of Twitter is that it's out in the open. Facebook is very different. So then if you think about, okay, well, let's just go and get informed consent. Let's do the right thing, and we'll make sure we contact every user. But if you actually think about that practically, there's nothing in the terms and services that allows you to recruit directly on, sort of approach people in social media to include them in a study. So they're not, you don't give permission to be approached by a third party specifically for the purposes of research. So we can't breach terms and service. Say, for example, we see somebody who's posted something that we think is suicidal. We don't have any right to then contact them and say, would you like to be in a research study? Then, which is a little bit different to maybe some hospital settings where a clinician rules that this person would be suitable. The other thing that, again, we always know that individual consent on the internet is difficult. There's no opportunity to reiterate what you're doing. We can't verify age and identity. And also, the participants on social media don't have any way of really verifying us. So, and the other problem with our research is that the pure nature of it, that it was passive, natural observation. So we all know that the moment you tell them, okay, we're going to monitor your Twitter posts for the next 8 weeks, things are going to change, and there's actually no point doing the research anymore. So we ended up coming to an agreement with us and the ethics committee that informed consent was actually not necessarily and not meaningful in this context of the research. But then the other issue comes with duty of care. So what happens if we were identifying tweets of people that were saying that they were wanting to die? So again, the issues that we had with that was that, first of all, we decided that we weren't going to get consent, so we can't contact them. And I'm not sure if any of you are aware of the Twitter app that was released, the Good Samaritans app. And the reason it only lasted 2 weeks is because it was breaching privacy. People were not giving permission as part of their terms of service to be monitored that way. I was looking at trying to figure out that if we were looking at our own feed and a post came up as suicidal, we just had to code it as whether or not we thought it was safe to ignore, strongly concerning, or possibly concerning. And really we were sort of trying to figure out how many strongly concerning tweets there were. But really, there was no certainty that what I deemed strongly concerning was actually true. So therefore, we thought it was really inappropriate to be contacting people based on a judgment which the study was actually trying to verify. Again, we felt that, it's not really fair because contacting them can lead to negative reactions from others and unwanted support. And one thing we found out from Black Dog is that the token response to people who are feeling suicidal is to call Lifeline. And that while that's really ideal, for a lot of people, they haven't had a really good experience calling Lifeline, and actually telling them that makes them very aggravated and is not necessarily the best thing, best practice. And I think that's one of the issues with social media, is that we don't know what best practice is in this context yet. So we felt that it was kind of a bit premature to be acting on that. In particular with suicide, the sheer volume of data, we all know that suicide fluctuates, and to actually have a timely response to every single suicidal tweet that was appropriate for that person's location and country was virtually impossible. And again, we had absolutely no evidence to show that contacting people was going to be more help than harm. So we agreed that there was no need to contact the participant. We would just take this as pure passive observation. Interestingly, because we were also going through CSIRO ethics, they stipulated that to get rid of the risk duty of care, we weren't allowed to touch the tweets for 8 weeks after we collected them. So they felt because we were analysing them not in real time, so that moment would have well and truly passed, duty of care was gone. So it's interesting how different ethics committees deal with that. And again, in terms, this sort of touches on the point of how we stored data and how we communicated it back. We originally had decided that we would blind every Twitter user. So when we identified their tweet, before we coded it, the computer scientists would take out the picture and take out the Twitter handle, and we'd just get left with the actual wording. But what the computer scientists said was that you guys should really see these Twitter names, and you guys should really see the Twitter picture, because often the Twitter name and the Twitter picture gives a lot of context to the suicidal state of a person. And so we then had to go back and say, actually, this is really important information, and therefore the research team was unblinded to the participants, and we could tell their username and their picture. But also because of the public nature of Twitter and because of searching, we cannot replicate any of the exact wording of tweets that we find, and therefore we exclude any, and when we say any identifiable information, it's anything from the Twitter data. And again, originally because we were storing so much Twitter data, like huge amounts, we were having troubles getting it on the university server, and that the CSIRO had higher levels of security. But again, because of our ethics constraints, we did have to then arrange a way to get it stored on UNSW servers, which prolongs the process, but it's actually quite important because what you do find is that you might want to recheck things about the data, and also partnerships change. And so we're no longer working with the CSIRO on that data, and we probably would have had a really hard time trying to get the data off them when that partnership ended. So in retrospect, having that requirement that it had to be at UNSW, even though CSIRO was more secure, it was ideal because in terms of the integrity of our project, we could ensure it for that 7 years. So the other issue we look at is social media for recruitment, and this is quite interesting because mental health problems is a very sensitive area of research, and often recruitment, I've seen some things happening that I'm like, oh, I didn't think that would happen. And one of the big ones is contamination of trials and blinding. So I saw something recently where we've got a trial at the moment for an online program that is aiming to reduce suicidal ideation. So the target sample is people who have chronic suicidal ideation. And somebody had commented on the advertisement post and had said that they were in the trial and that and started giving their suggestions about the content and whatnot. And I was thinking that's not really ideal to have. Because not only we are not supposed to know who the participants are, and now I know, and not only do I know, all of Facebook knows. And also to often, like, as most of you who work in clinical trials, and getting people engaged in research is a really difficult thing to do. And often when people find out that they're in the placebo, rightfully they're not very happy about it. And therefore they can actually contaminate the entire study by sort of sharing those views online. And so what that means is that if you are conducting trials, you really have to have somebody and we do have somebody monitoring it all the time, but it only has to be up there for 15 seconds. So that's interesting, and I was starting to think there probably needs to be something in the consent form that asks people to not share this information online, or explain to the study participants that sharing of this information has the potential to interfere with the trial. Because so I think that we also need to look about educating participants in it. Something else that I've seen that's interesting is that typically when we're doing our research face-to-face, we can't really, I as a chief investigator can't really identify people and go up to them and sort of try and get them to participate in the study, because we would call that almost with coercion. But what I've seen on Facebook and Twitter is people tagging other people that they think might be suitable to a study, and I'm not sure that's okay, because and I've seen it done, and I'm not really sure. I have never seen it addressed in an ethics committee, and I haven't thought about it in our applications, but we do recruit a lot on Twitter. And so I've been thinking about what are the repercussions of investigators retweeting things to their own networks when other people retweet things and tag others in it. Is this the same as the way it's done face-to-face? A lot of the things too we have questions about in terms of recruitment, for when you're recruiting via Facebook and recruiting via Twitter. Do you have to get ethics approval for every single wording of the tweet? Or do the ethics committees think that you're in a position where you're able to write your own wording, and therefore every time you want to write a new tweet you don't have to go back to the ethics committee? And even though that seems silly, but every time you're going to change your poster or change your flyer, you would go back to your ethics committee. So and it's really interesting because we've seen now with the news how defamation cases are different on social media in terms of traditional media because of the wording limits and that sort of thing. And we've seen how word limits can actually really change the meaning and the nature of what people are saying. So that's something that I'm unsure of. And also, again, really stipulating to the ethics committee how often you're going to be monitoring these pages, who's going to be responsible. Is it going to be a staff member that, for example, is in the communications department of our institute, or is it going to be a researcher who's monitoring the post? Is it going to be someone with clinical training? Because definitely when you're working in mental health problems, people are sharing stories online, and you really have to be prepared that that's going to happen. And I always think it's good if you can sort of have an outline of a plan of what you're going to do when you've advertised your study and somebody's commenting underneath it. And there are certain ways you can get around that. You can decide to have a recruitment ad that doesn't allow comments. And the last thing that we use it for, and I think this is one of the greatest potentials of social media, is that we do tend to have an issue in society where people don't really understand science, and there's a big disconnect between researchers and sort of the community. And one of the things social media allows us to do is really connect with the community and try to increase their awareness of research, best practice, and try and engage them with the research that we do. And so, and dissemination is one of, social media is really great for dissemination. And it's great to get it's a great way to communicate your research findings to a huge number of people. But again, looking at whether or not it's appropriate to share research findings in this way. Do we really have to adapt our language? And And sort of thinking about, okay, well, what's the end point? What's the exit point for using social media? Once your study's finished, what are you going to do with all those people that you've kind of created this sense of community with or sense of connection with? I think trying to think about the life course of social media in the research process is really important. And some of the other issues, these are not so much with the Institute, but some of the other things that I've seen coming out from other people's presentations is I've seen like clinical trials where they ask for the Facebook ID as a way to follow up with participants, and it's similar to asking for your phone number. But then I was sort of thinking about, well, what's the protocol? Like, are they just going to be contacted out of the blue? How do you kind of manage that information and that approach in a longitudinal study? Should we be allowed to see people checking in at clinical trial centres? Again, publishing photos and sharing trial content online, people do that, particularly if you're doing online programs, screenshotting and that sort of thing. And one of the things we've looked at recently, we wanted to start up another individual page for a study that we have, and we eventually decided against it because we didn't actually feel that while it would help boost recruitment, did we actually think it was going to improve the integrity of our research? And we thought there was more chance that it would compromise it than improve it. So I guess in the future where we're heading, one of the really good things is that there are so many more resources coming out around how to use social media for research purposes. Lots of ethics committees are writing their own discussion papers on it. I feel that everybody's becoming more educated in this field, both researchers, ethics committee and the general community. But I think particularly in my field with suicide and direct intervention, we could see with the public reaction to the app, which could detect it, that there are certain things the public are and aren't ready for. And I think trying to make sure we really understand that in our ethics applications and research is really important. That's me, done.